Hello everyone, hope you all are doing good. Today I'll be starting a new series, that is Conference Spotters. I'm recording this from Bombay, from Sonobuzz. So this is where Sonobuzz is happening this time, that is Sahara Star Bombay. And this is the series is actually having certain spotters of day one session. These are some vascular compression syndromes. So here we have a 50-year-old female who came with complaints of acute left pain on ultrasound, and a DVT was found in the left calf veins. A CT abdomen was done to look for any systemic pathology, and this is the axial section of the CT, and this is actually a image that depicts the pathology. So here we can see on contrast, post-contrast images, this is the right common iliac artery, this is the left common iliac artery, this is the right common iliac vein, and this is the left common iliac vein. The left common iliac vein is significantly compressed against the lumbar vertebrae. Now this is because the right common iliac artery is actually compressing it. So this is the right common iliac artery compressing the left common iliac vein. So what exactly is the syndrome called? So this is actually a vascular compression syndrome called May-Thurner syndrome. Refers to chronic compression of left common iliac vein against the lumbar vertebrae by the overlying right common iliac artery with or without deep vein thrombosis. So when we diagnose a case of deep vein thrombosis, our diagnosis is not finished. We have to do further workup to look for any cause of DVT. So in this patient, this May-Thurner syndrome, that is compression of the common iliac vein, was actually causing this thrombosis. This is a second spotter, a 60-year-old male with medical history of postprandial cramping pain, weight loss and nausea. And based on these images, that is axial section of the abdominal angiography that has been provided, and these are the reconstructed images. What do you think the diagnosis is? I'll give you some time to appreciate the findings. This is the first branch of the abdominal aorta, anterior branch of the abdominal aorta, and these are the reconstructed images. There is some narrowing that is seen at the origin of celiac artery. Actually, this narrowing is caused by the arcuate ligament of the diaphragm, and which can also be appreciated on the reconstructed images, because of which this patient is experiencing these symptoms. This syndrome is called Dunbar syndrome. So celiac artery compression syndrome or median arcuate ligament syndrome or Dunbar syndrome is actually a rare condition characterized by upper abdominal pain in the setting of compression of the celiac trunk by the diaphragmatic crura. Coming to the third spotter. So this patient complains of intermittent macroscopic hematuria. Repeated episodes of gross hematuria and left flank pain was also present. What do you think the diagnosis is on these post-contrast CT images? So these are the kidneys, and this is the left renal vein. The left renal vein is actually being compressed between the superior mesenteric artery and the aorta here. This syndrome is actually called Nutcracker Syndrome. So Nutcracker Syndrome is a vascular compression disorder that refers to compression of the left renal vein between the superior mesenteric artery and the aorta. Although other variations also exist, they can lead to venous hypertension, leading to a rupture of the thin-walled veins into the collecting system, resulting in hematuria. So this is why the patient was having hematuria. The compression of the left renal vein can occur primarily in two anatomic locations. One is called the anterior Nutcracker syndrome, the other is posterior Nutcracker syndrome, which is actually a rarer form. In posterior Nutcracker syndrome, the retroaortic left renal vein is compressed between the aorta and the vertebra. In anterior Nutcracker syndrome, there is reduced aortic SMA angle. The normal angle between the aorta and SMA is about 45 degrees, ranging from 38 to 65, anything is normal. Below that is actually a reduced aortic SMA angle, which can cause left renal vein stenosis. We can also identify some collateral pathways in certain cases where the main collateral pathway is the left gonadal vein, which will display early enhancement during portal venous phase. Coming to the next spotter, so this patient had gross loss of weight over the last 2 years following a complicated abdominal surgery, and there was marked ischemic gastritis seen on endoscopy. What do you think the diagnosis is in this case? So we have been provided with the angiography images of the abdominal aorta. These are the sagittal sections and these are the coronal sections. On sagittal images, what are the findings that can be appreciated? So there is no opacification of the celiac trunk and the superior mesenteric artery, because of which this particular collateral has been developed. So I wanted you to name this particular collateral here. This actually is the marginal artery of Drummond, which actually is an anastomotic pathway between the superior mesenteric artery and the inferior mesenteric artery. So this is a case of mesenteric ischemia with occlusion of the celiac artery and the superior mesenteric artery, and the marginal artery of Drummond, also called the marginal artery of the colon, is a continuous arterial circle or arcade along the inner border of the colon formed by the anastomosis of the terminal branch of the superior mesenteric artery and the inferior mesenteric artery. This is the marginal artery of Drummond. This actually opens up during a case of mesenteric ischemia causing occlusion of the SMA. So there is another case of a post-renal transplant patient came with complaints of acute abdominal pain, and an ultrasound there was severe hydronephrosis on the transplant kidney along with pan-diastolic reversal of the renal artery. But there was no evident thrombus that was seen on the renal vein. Pan-diastolic reversal of the renal artery is quite specific for renal vein thrombosis. But in this case, there was no renal vein thrombosis that was seen. What do you think the diagnosis is? This is the Doppler images. This is the gross hydronephrosis. The Doppler images show reversal of the diastolic flow in the renal arteries. So the renal vein thrombosis ultrasound usually on gray scale shows renal enlargement in case of in early cases and decreased size in late cases with increased leukogenicity. Doppler findings, a very specific finding is reversal of the arterial diastolic flow, absent venous flow, and visualization of the thrombus within the lumen with high resistance in the renal artery. But in this case, you have to think of other causes of pan-diastolic reversal, which includes a severe hydronephrosis with renal congestion in a post-transplant kidney, which can also lead to pan-diastolic reversal. So after decompression of this particular condition, the flow actually improved. Also, pan-diastolic reversal is also seen in post-traumatic limb compartment syndrome and pseudoaneurysm of the neck. So this is the conference hall.
Thrombosis could be due to lymph edema or any other.
That we can see this.
Or maybe the entire liver
lecture.
is hypoechoic, that is why you are getting this, but that is always on both the sides of the portal.
Beautiful grand hall where the conference was conducted.